The MK Mental Health Hour with Arthur Ellis Mental Health Support in partnership with Thomas Connolly Estate Agents and MKFM.
It's just gone 7 o'clock on your Sunday evening. Hello, it's Leah with you for another Milton Keynes Mental Health Hour. This evening, we're going to be discussing stress with Dr. Krishna Patel, a local GP, and John from Arthur Ellis Mental Health Support, as well as playing MK's biggest hits like this from Rihanna.
The MK Mental Health Hour in partnership with Thomas Connolly Estate Agents.
Rihanna, Calvin Harris, We Found Love on MKFM. Good evening. It's Leah with you on the Milton Keynes Mental Health Hour. We do this every single Sunday at 7 o'clock on MKFM, joined by John from Arthur Ellis Mental Health Support. Hello, John.
Hello, good evening.
Hello,
How
good
you doing?
Lovely, thank you. How are you?
Good. I'm all right, thank you. Yeah, not too stressed at the minute.
Well,
is nice.
It's nice that you've said that, John, because we're actually going to be discussing stress throughout the hour this evening. We'll talk a little bit about our expert guest who is joining us in the studio. But before we go into that, if people haven't heard about Arthur Ellis Mental Health Support and the work that you do in Milton Keynes, can you tell us all about it?
Yes, yeah. So we're setting up a one-to-one emotional support service for children. We want that to be free, so we provide training into businesses, we provide products made by Ed Sheeran's mum, Imogen, and we're always looking for more products as well to build into that, which the profits go to providing children with these sessions. And we also, so we work with businesses to train them in how to deal with mental health long term and some different tools and strategies. So we've won a few awards in doing that. So any businesses out there, you can get your people trained and help kids.
And you've been really busy training people up over the last few weeks, haven't you?
Yeah, so we train now in around 13 areas around the country.
Wow.
And we've, in the last couple of weeks, there's been close to 200 people that we've trained.
Incredible.
And we're only a small team, so it's been quite busy.
Yeah.
It's been quite busy, but really, really good because we can help a number of children off the back of that. So it's really, really lovely and rewarding.
Absolutely. And before we get started, if people want to find out more details about Arthur Ellis Mental Health Support, they can go onto your website, can they?
Yeah, they go onto our website. It's Arthur Ellis MHS for mentalhealthsupport.com. And all of our social media tags are Arthur Ellis MHS. So you can just search us on anything and we'll hopefully come up.
And one of the other things that you just mentioned briefly before we came on air that you're up to is you're going to be doing a panel at Cambridge Union.
Yeah, so I've been asked to go and talk about what we're doing because we're looking at building this sustainable service for children without being reliant on funding. So I've been asked to go and share my story, share what we're doing with Arthur Ellis, and then sit on a panel where there'll be Cambridge students throwing questions at us.
I mean, that sounds to me, and I do the radio every day, that sounds quite stressful in itself.
Yeah,
But
and you don't know what to expect.
No.
Don't know what questions you're going to get, whether it's going to be about you personally, which kind of you need to answer, maybe, and then it could be about Arthur Ellis, or it just could be your opinion in general. And I made the mistake of Googling Cambridge Union because I didn't actually know what it was.
Right.
And then I saw that Stephen Fry was there.
Wow.
And Bill Gates was there 3 weeks ago. So I'm kind of really now...
Well, you're now going to be added to that list. John from Arthur Ellis Mental Health Support.
Very frightened of being a massive disappointment to
You
all of the
absolutely
Cambridge
won't
students.
be. You're going to be amazing.
Yeah,
the
be
best
right.
of luck with that. But we have mentioned about stress, and that is exactly what we're going to be talking about as our topic of the evening. You have brought in with you a local GP, Krishna Patel.
Yes.
Now, you said she is a GP extraordinaire, I think you called her.
Yeah, absolutely. Well, we ended up, she's so interesting, just a lovely person. And we ended up sitting down, speaking about the show and stuff. And we ended up talking for a fair while, just about everything that's not related to the show.
Right.
We did plan it, so don't worry. But we ended up just going on loads of different tangents just because she's incredibly interesting. So it's going to be really good to get her take on stress. Obviously, as a GP, she sees it pretty much every day. Helps to treat it and guide people, but also she works in the CCG, the local commissioning group, in relation to mental health. So we're going to be hearing about her role and what she does to help people.
Fantastic. Well, we're going to be hearing more from Krishna herself after Jordan Sparks now. This is SOS on MKFM. Jordan Sparks and SOS. Let the music play on MKFM. Hello, it's Leah with you for another Milton Keynes Mental Health Hour. This evening, we're talking about stress. And joining me in the studio alongside John from Arthur Ellis Mental Health Support is a local GP, Dr. Krishna Patel. Hello, Krishna.
Hi, Leah.
Thank you so much for joining us this evening. John actually described you as a GP extraordinaire. millionaire. So it's lovely to speak to you and find out a little bit about your background. So how did you become a GP and how did you get to work with mental health?
Okay, so first of all, I'd say thank you for having me on the show, and thank
pleasure.
you to John for the very over-generous introduction, but much appreciated. So I am a GP in Milton Keynes, and I have been for a few years, and I started working for the CCG, as John mentioned, back in May, which is our local, it's called our clinical commissioning group, and they deliver health services to patients or people all across Milton Keynes.
And is that a huge variety? Is that all health services? Is that everything?
It is, yeah. So it includes physical health problems, or hospital services, ambulance services, community services, and mental health services as well.
And then is it from there that you kind of narrowed down exactly what you wanted to do and work within mental health?
Yeah, so I was given the option of taking lead on a particular area, whether it was cancer care or mental health, and I chose mental health. So I was given about 4 options, but that's something that's sort of stood out to me.
And why did that stand out to you?
I think it's a really important area of medicine that for many years hasn't really been addressed.
Yeah.
And there's a lot of focus on it at the moment nationally, and people are more interested in it, wanting to invest in it financially and with sort of human resource as well. So the energy kind of that there is towards mental health inspired me to get involved to try and help move things along.
GPs tend to see quite a lot of people in relation to mental health, but it's not specifically part of GP training as such, I don't think.
No, you're
Correct me if
quite
I'm
right.
wrong.
That's part of the issue, I would imagine, is that, so I was lucky enough that I had a 4-month rotation in psychiatry. Having said that, it was in a hospital setting, so it's for very, very poorly patients with mental health problems, but we don't have the exposure to the mental health that we see in general practice. And I was fortunate to have had that post, but most GPs will not have had that post.
So this is a great opportunity now to get more embedded and see if you can make a difference.
Yeah, absolutely.
And
this
that's
is
something.
This is why I say that she's so lovely.
Yeah, and that's amazing. That's something that you're really focusing on, and it's right here in Milton Keynes as well, which is absolutely fantastic. So tonight we're talking about stress.
Yes.
Now, I have a question, and it might be a stupid one, but is stress classed as a mental health issue?
So yeah, John and I had this conversation when we met for the first time a few weeks ago, and no, so technically no, it is not defined as a mental health problem or a psychiatric problem, which I think is where the problem probably starts.
Right, yeah.
It is closely linked to mental health problems. If it's not controlled or managed, or you don't understand or recognise that you're under stress, then it can evolve into things like anxiety or low mood.
And then those end up being classed as a mental health.
Exactly.
Okay.
Yeah. So stress can be like a trigger for those sorts of things, but it's not in itself something that you can't be necessarily diagnosed with stress, or explicitly like treated for stress as such. There are more.
It's the conditions that come from stress that you can.
Yeah, absolutely.
Right.
And sort of looking at stress and covering off stress is something that we want to kind of bust that myth, but also provide some practical stuff as to what you can do about it yourself. Yeah. What others can do to help, and working with businesses. You know, employees are always under so much stress. We see it all the time. So hopefully from this show, people can start the ball rolling on it. Fingers
crossed. So stress then, I mean, we sometimes talk about it a little bit kind of nonchalant. We say, oh, I'm feeling quite stressed, or I'm feeling anxious. Yeah. Where does it come from, stress?
So you're quite right. The term is used very loosely.
Yeah.
So if we've had a bad day or things aren't going our way, we often use the term, I feel stressed. So often people don't hear it when we're saying it. They're just, oh, she's just stressed.
Yeah.
And it's a word that we use to describe how we feel. So I think we feel overwhelmed. When we use the word stress, we're often feeling overwhelmed that we can't cope with whatever's being thrown at us, whether it's 1 thing or 10 things. We've just reached our threshold. Yeah. I don't know what you have to say on that, John.
No, absolutely. And I think stress is like defined, and we've got the guide that we're putting together. It's sort of when you get into that flight or fight response. Yeah. So anything that comes across like a situation that we've got to deal with, we're immediately put into that. Do I run away? Do I tackle it? So we're hopefully, or we should be under that kind of pressure very periodically. Yeah. So as humans, we tend to be in that situation when we're addressed with a saber-toothed tiger back in the day.
Right, yes.
But nowadays, it's kind of more drawn out, and we're under stress for a longer period of time. So it's being able to deal with that and manage it in the new kind of culture that we're in, the social environments. Otherwise, mental health issues can develop.
Okay, well, we're going to be delving into all of those kind of things after we hear from Diana King, Shy Guy, which plays for you next.
The MK Mental Health Hour with Arthur Ellis Mental Health Support.
We are loving that here in the studio. Diana King and Shy Guy on MKFM. Hello, it's Leah with you for another Milton Keynes Mental Health Hour. Tonight we are discussing the topic of stress, and we're joined, as we always are every week, by John from Arthur Ellis Mental Health Support, and this week by local GP Dr. Krishna Patel. So we've been speaking about stress levels, and we started talking about the initial signs of kind of where it starts. Before we kind of delve into that and the kind of different extremes of stress, John, you just read out quite a shocking statistic about stress.
Yeah, well, in 2018, YouGov did a survey just for random people, not specifically focused on anyone in particular, and it was about just over 4,500 people responded, and 74% of people felt stressed or unable to cope with just day-to-day life.
I mean, that is astounding, isn't it? And do you find that in your clinic, Dr. Krishna?
Yeah, absolutely. So, I mean, it's a phenomenal statistic, and it definitely is reflective of what we see day to day in general practice or in any other setting, whether it's A&E or urgent treatment centres. The root cause tends to be stress-related in that percentage of cases, for sure.
I can imagine 74% of people aren't going to see the GP, though.
Exactly.
Like, how often would you say a GP kind of sees somebody and it's a stress-related issue rather than sort of a medical thing?
So often stress presents in many different ways, and that can range from feeling excessively tired, so that's a common presentation, having stomach problems, so a lot of people will get acid or tummy pains, headaches, generally worse towards the end of the day, so they'll get home, have a headache, and then it will kind of filter off as the evening goes on.
So those would be some of the kind of initial signs that people might experience with stress, and it might be something that they wouldn't even, I mean, people might be listening now thinking, I'm not stressed, I'm fine, but then you just saying, you might have a headache towards the end of the day, people might be able to relate to that, and there's those are the initial signs to start looking out for.
Yeah, absolutely. So there's loads of them, so those are just a few, but people have palpitations, they can often have emotional problems as well, so they might be feeling a little bit more irritable with their relatives, or having difficulties with their relationships or friendships because they're maybe a bit more frustrated or angry about things. And it can also affect the way that they kind of spend their free time, so they might start taking up unhealthy habits like smoking or alcohol, and that's often something that I see where people say, I've started drinking a bit more, for example.
And we sort of said, I was quite surprised, because usually you associate smoking with, I'm going to go have a chill out, have a cigarette, it's going to calm me down, but in reality smoking doesn't have that effect. It actually it adds more stress onto you. Is that right?
Yeah, it increases the burden of stress, absolutely, and then it's a vicious cycle. Yeah,
it's really, really weird.
So it's really important actually to identify when you are feeling stressed, and to actually put a bit of a stop on those things, or learn how to cope with it in a better way. And you mentioned that there are three kind of different areas, physical, emotional and behavioural, that it can kind of come out
absolutely
in. Yeah, and that's kind of covered in some of those symptoms that you mentioned.
Yeah, and I think it's important to recognise that everyone has a different threshold, so never compare yourself to others. So what may seem like a very small thing that you think, well, it's making you feel stressed, but it's small in comparison to what so-and-so is going through. Never kind of underestimate your own threshold. And if you're feeling stressed, it doesn't matter that it feels small to you. If it's making you feel that way, you need to do something about it.
Because we also spoke about if there's kind of like existing conditions, very difficult thing to say. If there's like an existing condition, because we said about there's different extremes, so you might initially start seeing that your sleep's getting a bit disrupted, maybe you're getting headaches towards the end of the day, and then all of a sudden after you've been out of work for an hour or so, it's miraculously better.
Right.
It's not necessarily eye strain with the computer, it might be something else going on. So we also said that if there were more extreme levels of stress, there could be things like skin conditions coming out and
absolutely
stuff like that.
Some people who already have skin conditions like eczema, they can get worse, but sometimes if you've never even had a skin condition, that can sometimes become a new problem for you.
Trigger it off.
Absolutely, yeah.
And lots of different things like cold and flu and sore throats and things, I suppose they might be prolonged. John, you mentioned about you having tonsillitis
awful time.
for 3 months or something.
Yeah, well, it wasn't tonsillitis for 3 months.
Right.
It was, so I had tonsillitis in May. So funnily enough, tonsillitis I got from stress. So we had Mental Health Awareness Week is in May, and in the 5-day week, I had 9 events that we had to do.
Oh, wow.
Some were in London, some were here, and it was a lot of running around. Wonderful week, but stressful.
Yeah.
So sort of immediately, basically on that Saturday that the week ended, I got tonsillitis.
And I think a lot of people can probably relate to that, because I even
Yeah.
remember when I handed in my dissertation at uni,
Yeah.
the day afterwards,
Yeah.
I was so ill. For weeks after, I was so poorly.
Yeah.
And I think
It's like
everyone,
a come down off of this
Exactly.
like adrenaline rush you've been
But
on.
that is from stress then.
Yeah, so I developed tonsillitis, just sort of home remedied it. I didn't really think I'll go to the GP, but then tonsils were fine, didn't have any more tonsillitis, but I had a sore throat like after that, and that lasted for about 3 months.
So these things can continue and they can be very, very problematic. Well, we're going to be talking about how you can cope with stress and how to begin treating after we hear from Lady Gaga now. This is The Edge of Glory on MKFM. Love that from Lady Gaga. The Edge of Glory on MKFM. This is the Milton Keynes Mental Health Hour. Tonight we're talking all about stress with John from Arthur Ellis Mental Health Support and Dr. Krishna Patel. So John, we briefly mentioned about how different levels of stress can kind of come out in a physical symptom.
Yeah.
And it can go on for a really long time, can't it?
Yeah, well, there's a couple of reasons, and if you think about, we mentioned earlier about the fight or flight response, and that's kind of the stress that you can come under. Back when it was, oh my God, there's a saber-toothed tiger, that's a split second. We consider fight or flight being in a very split second. But now if that's prolonged, you think if you're in that kind of split second decision-making thing, you've got to make that decision very quickly. So the body isn't worried about digesting. It's not worried about having sex or anything like that.
Yeah.
So in relation to having a prolonged period of stress, your body isn't digesting properly. So that's where you start seeing those physical issues
Right.
with things like IBS or these other physical issues that may come on.
And actually, it would only be at that stage, probably, that they would then go and get help from a GP, say. That's when those
Absolutely.
physical things have kind of come out. And
Yeah.
actually,
Yeah.
what we're trying to say tonight is that we need to start with acknowledging and identifying what the stresses are and how you can begin to kind of treat them.
Yeah, there's a variety of things that you can do to just start the ball rolling on breaking that negative cycle, so you can mitigate any mental health issues developing from it.
Right, okay. So firstly then, to begin treating and things, I guess you have to figure out what the core cause of stress is. And what could those stresses be, Krishna?
So they could be anything and everything. So often we think of the big things like bereavement or going through a divorce, financial problems, loss of a job. But they're the big things. But we all have other things going on day to day that might not hit everyone else's radar, but we are finding difficult to cope with. For example, I don't know, whether you're struggling with cleaning your house and keeping up to date with house chores, as well as looking after the
I
kids.
know I am.
Nightmare, aren't they? Nightmare.
And just trying to make everything work and fit into the day.
Yeah.
Is certainly a massive source of stress, particularly as John mentioned earlier, in the kind of environment that we're living in now and the expectations of society. So
Yeah. Like, you should have a really nice car. So
Yeah.
you might look at your car and think, oh, that's not great, or it could be a lot better. You might have, and coming back to cars, all the maintenance for those. Got to remember when your MOT is.
Yeah.
You've got to service it. You've got to do all this stuff.
Everything brings its own stresses,
Yeah.
doesn't
Yeah.
it? And
Yeah.
we're kind of bombarded with everything every single day.
Yeah.
So to actually start to deal with those stresses then, you suggest kind of making a list of all of those stresses.
Absolutely. So I think I'm very much a list person. It's not for everyone, but actually seeing something in black and white makes it a little bit more rational and achievable to sort things out. It's important to remember you can't sort everything out. Not everything has a solution. Some things you do have a practical solution and you can say no to doing something. Some things you know will go away. That stress will go away and it'll get better. You just need to give it time. And some things are out of your control. And that's where you need to then develop strategies to deal with the stress.
And I suppose then you can prioritise your list into, what you need to take the time and really focus on at that moment, and you can leave the other things that may be more long-term kind of further down the list.
Absolutely. I think we need to remember we're only human. Be kind to yourself. You can't sort everything out. So prioritisation is absolutely the most important thing to start with.
So, like, get them all on paper.
Yeah.
Really have a look at them.
Yeah.
Look at which ones you can deal with. Look at the ones that you can't deal with. Prioritise them.
Yes.
And then I think we also said about making sure that you actually allocate that time to deal with it.
Absolutely, yeah. And just sort of related to that is also looking at the softer things that you can't necessarily put into a list. I know for me, a mobile phone is a massive source of stress. So every time I look at it and I see an email pop up, if it's in the evening, I suddenly then stop engaging with my dinner and family or whatever and start worrying about the email. So it's just looking at other things that you might not necessarily put as a stress or perceive as a stress, but actually
they are a huge stress. And it's so important about actually taking the time, allocating that list or doing whatever kind of works for you, and making sure that you're actually kind of ticking things off on that list to make you less stressed, because it's so important. And I mean, they can end up being very difficult. I know you were talking about maintenance and things, John, but if you kind of get in a vicious cycle, it's very difficult to get out of. So it's so important to be doing these things.
Yeah, well, there's things in, and I'm not a psychologist, but I've been through psychology, and there's certain things that you do called maintenance factors, which maintain your condition rather than improve it.
Right.
So we kind of get stuck into this rut. So if you look at things like stress, and we said about smoking and alcohol and gambling and all of that sort of stuff, we can turn to these things that we have a really, we get gratification from them, like, immediately. But actually, if you gamble a lot and it doesn't go too well, that's going to just add to your stress and add to those financial worries and maintain your state rather than get out of that rut.
Absolutely. We end up adopting unhealthy behaviours that we think are helping with our stress. As John said, the alcohol, the gambling, but also day-to-day things. We're not sleeping well because we're stressed, but we don't recognise we're stressed. So we drink more caffeine to keep us awake in the day because we're tired. And then the cycle goes on and on.
I think there'll be a lot of people listening to this tonight that can definitely relate to everything you are saying. And I think everybody has been stressed at different levels throughout their life. And that's why it's so important that we do shows like this and that you guys offer the support that you do within the community. We're going to continue giving away those really good tips and actually talk about unwinding after we hear from Jamelia Superstar, which is on the way for you right after this.
The MK Mental Health Hour with Arthur Ellis Mental Health Support.
Jamelia and Superstar on the MK Mental Health Hour tonight, talking all about stress with Dr. Krishna Patel and also John from Arthur Ellis Mental Health Support. So Krishna, we have mentioned one of your kind of top tips with dealing with stresses is to actually make a list and kind of designate time for that list and work your way through it and make sure you're kind of addressing the things that do stress you out and make sure that you kind of do less of those things.
Yes.
But aside from the list, there are some other kind of good tips and things that you can do to combat stress. One of them being unwinding.
Yes.
So what counts as unwinding?
Good question. So it's basically what it means to you. So some of us find exercise is a way to unwind, watching half an hour of your favourite series on TV, going for a walk. So there's a lot of overlap between unwinding and exercise, which are both equally as good for your mental health. But yeah, John, what do you enjoy?
I'm a big advocate for exercise. Yeah. I tend to use that, but it's just anything you find enjoyable. Typically, if we are particularly stressed, those enjoyable things will drop off. Probably recognise that if you have a really bad day, last thing you want to do is go and do some exercise or go for a run. Yeah. So it's just having an emphasis on those and making sure that you are keeping on top of them. And while you're allocating time for your list, I suppose you could allocate time for things like that.
Yeah, I know I certainly allocate half an hour in the morning to watch the news and drink a coffee.
Because that's the thing that you enjoy doing.
So I wake up a bit earlier so I know I can fit that in because actually the rest of my day goes a lot better and I feel a lot less stressed.
Yeah, because you've worked silly hours before.
Yes.
But you had like a ritual, didn't you? Every day.
Yeah.
Was it 1:30?
You're the first person I shared this ritual with, actually.
Oh,
yeah.
Maybe share it with a lot
Share
more.
it with us, yeah.
So a couple of years back, I was in a very difficult job. It was very enjoyable, but also very stressful in the 12 to 15 hour days.
Wow.
So what I found myself doing was leaving my desk about half 1, 2-ish for about 10 minutes to go to the local coffee shop to go and buy coffee because I was feeling tired. And then over time, I realised that I kept doing this, and it wasn't about the coffee. It was actually about the interaction with the owner of the coffee shop, who was Italian, a very nice man. And we'd always have a couple of minutes chat, and he knew the coffee I wanted. It's almost ready for me when I got there. And that positive human interaction made a massive difference to the rest of my afternoon.
So human contact is a really important part of this.
Yes, definitely. Yeah.
So exercise around humans. Even if it's just going for a walk, and if it's a consistent time, you might see the same people walking their dogs or something, so you can say hello to them. Those little flits of positivity can just help while
you
you're
going
working
throughout
through
your
that
day.
list. Yeah.
And you mentioned about having caffeine because you were obviously really tired. You're doing 12 to 15 hour days.
Yeah.
I imagine sleep is a really important factor as well.
Oh, absolutely. So I think we don't dedicate enough time to sleep. We undervalue or underestimate how important sleep is to our mental health and to our stress levels. So there's a temptation in the weekdays. Most of us don't sleep enough. So really we should be getting at least 7 to 8 hours of sleep. But I don't think that happens for very many people. And then there's a temptation at the weekend to lie in. So there's a lot of evidence now to say that lie-in actually increases your stress levels. So we should all be waking up and going to sleep at the same time every day, including the weekend, as long as it's within an hour sort of period.
So you can kind of have a lay-in for an hour or so, as long as you get up and like kind of keep that consistent pattern.
Even if you're tired, get up, and it's fine to have a nap in the day.
It's fine to have a nap in
You're
the day.
better off doing
so
that.
just pause your lie-in.
Exactly.
Yeah,
I like that, John.
Cat naps are brilliant.
Very nice. And
Yeah.
actually, we did do an entire podcast about sleep hygiene and things like that as well. So if you want to check that out, it's over at mkfm.com. We're going to continue with these great tips after Michael Gray and The Weekend now. It's MKFM. Michael Gray and The Weekend, an absolute anthem for your Sunday evening. It's Leah with you for Milton Keynes Mental Health Hour. Tonight we're discussing stress with Dr. Krishna Patel, a local GP, and John from Arthur Ellis Mental Health Support. John, we've discussed so many amazing tips. In quick summary, if people miss kind of parts of it, what have we kind of found out tonight?
Absolutely. So there's kind of two ways in which you can start tackling your stress, apart from initially just recognizing that you are. So if you can recognize that you're starting to have those physical responses, maybe existing conditions are getting a little bit worse, make a list of everything that stresses you out. Some things you can then divide into stuff you can deal with. Some things you just need to ride out and just let it have that time. Start then figuring out how you can practically deal with those things and take some action on doing that. And then alongside that, making sure that you're allocating time, not just to deal with those stresses, but allocate time for yourself to unwind, whether that's exercise, whether it is building in walks, and similar to Krishna's flat white story of having a little bit of a ritual where you're getting some human contact throughout the day, maybe going for a walk and seeing people that you recognise and just saying hello to. So making sure those are built in throughout your day, and then making sure that under this stressful period, your sleep is not changing too much. So throughout the week, have consistent sleep, and then at the weekends, don't lay in too much. Have a nap a little bit later on in the day. Try and keep your waking period to within an hour. If people do find it difficult to implement all of this, they can certainly reach out to us. Our one-to-one service is available for adults, and if an adult refers, we do charge for those sessions, but the adult is able to support a child as well, so we allocate funding towards a child.
And if people want to find out more information from you guys at Arthur Ellis Mental Health Support, how can they do that?
Yeah, they can head over to our website, so that's arthurellismhs.com. That's where the guide to all of this stress stuff will be as well. So our stress guide will be on from Monday, and they can just freely download it and then get in touch with us if there's anything else that we can help them with.
Fantastic. Well, thank you both so much for this evening. John from Arthur Ellis Mental Health Support and Dr. Krishna Patel discussing stress. We will be podcasting this interview as well over on our website. If you would like to share it or listen to it again, everything will be over at mkfm.com. Very quickly, John, before we go, what are we talking about next week?
We're going through bullying. So it's focused on children bullying, but also adults may relate to it as well. So it's about bullying, how to tackle it, how to do it in the right way.
Okay,
well,
really join us next Sunday for another Milton Keynes Mental Health Hour from 7 o'clock.
The MK Mental Health Hour, in partnership with Thomas Connolly Estate Agents.